Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical practice experience. And I'm here to talk to you about some of the things to watch out for when you leave the hospital if you've had any hypertensive disorder of pregnancy, so high blood pressure problem with pregnancy. And that might mean something called gestational hypertension or preeclampsia or severe preeclampsia. You also have chronic hypertension, so you had high blood pressure before. All of those things are things that warrant a little bit of extra vigilance after you have the baby. If you have none of these, you still are at risk for a hypertension problem after pregnancy, so it may be worth listening to these general guidelines. So as of 2022, and I'm telling you this because guidelines can change, and this is educational, so you want to be sure to get your specific information from your own physicians to know what you should do in your particular circumstance. But generally speaking, if you have any of these blood pressure problems, then you need a blood pressure check about 3 days, 2-3 days after you deliver, and then again at 7 to 10 days after delivery. And the reason for that is some of the blood pressure problems can get worse, or they can first show up after delivery. In fact, if you've heard of preeclampsia, that's a high blood pressure problem that can have protein in the urine, and blood pressure goes up, and some of your lab tests can be abnormal, and you can have swelling and more bleeding issues. But preeclampsia is pre to eclampsia, and eclampsia is a seizure, and a seizure is certainly dangerous and can be a big problem for you. Before you're pregnant, can be a big problem for you. Before you deliver, a big problem for you and your baby, and also afterwards significant risk, so it needs to be followed up on. So we certainly don't want you to have that. So one of the precautions is avoid driving, because if you have a risk for a seizure, you certainly don't want to be driving. Now, when you have a new baby at home, you're not going to be getting as much sleep, so headaches are pretty common. Try your best to get some sleep, take some naps, take some Tylenol. Tylenol is helpful for the headaches, but it's usually better if you take it when it's a mild headache and not when it's a severe headache. Drink lots of fluids. If your headache doesn't go away or gets worse, that's when you need to get help. You need to ask or contact your support team or go back to labor and delivery, okay? We can't really check your blood pressure over the phone or see what's going on. So if you're at risk for those things, you really need to be seen. So that's really important. Try to avoid salty things. So pretzels, Doritos, sorry Doritos, love you. And peanuts and Chinese food. Some of the added salts can make you a little bit more puffy. Generally, the swelling can last up to 2 weeks afterwards. If you are on a blood pressure medicine, hopefully you'll get off, but generally speaking, your physician will check you or try to get you off that within a month. So you may be on one afterwards. If you had high blood pressure before, your medicines might need to be changed. Right now, the current common medicines that we give during pregnancy for blood pressure is called labetalol or nifedipine, and an Aldimet is an older medicine that's given. So those are some that you might be on. I hope that you found this useful, this information, and be sure to look at some of the reference connections that we've provided, and also be sure you have clear instructions specific for you from your physician and physician team, so that you know the type of follow-up you have. You might need an extra blood test, you might need to be seen at different times. Be sure this is not something to just let go without following up on. Thank you.